Brittney Ellers is a holistic pelvic embodiment guide and physical therapist specializing in women's well-being throughout all stages of women's lives. Brittney, thank you so much for being with me today. I'm so excited to talk with you.
Thanks for having me, Miranda. I'm
My
super
pleasure.
stoked to be here.
Yeah. And I do have to, before we get started, I just have to shout out to you because you are absolutely one of the most embodied people that I've ever met. And this is something that you help women do. And I think it's so rare nowadays that women can
Mhm.
actually feel in deep connection with their bodies. And so before we even, we'll talk about that a little bit more, but I just want to give you this like really warm shout out because I think it's so special and unique. And most women don't even realize, I think, that it's a possibility to be
Mhm.
in such amazing connection with their body. So,
Thank you for that. I
yeah,
I feel so seen.
I'm
I
glad.
try.
That's my goal. So, as we get into it, I'd love to hear from you kind of like what inspired you to get into the field you're in and be in a very like unique position in your field too.
Totally. Yeah, there were quite a few different things that initiated me into this work as a pelvic physical therapist. I feel like first it was just that I had my own issues and I'm like always kind of forgetting exactly what the timing was, but
Mm.
I experienced some pelvic floor discomfort, some pain that actually manifested more as urge incontinence and feeling like I had to go to the bathroom. And this was after a self-pleasure session with a vibrator. And this was a 5 minute, 10 minute, maybe max session that I hopped off the bed afterwards, went to work, and it had aggravated my pelvic floor so much that it was stimulating my pudendal nerve, which is the nerve that gives sensation and muscle function to everything down between your legs. And it was making me feel like I had a UTI, like very UTI
Mm.
like symptoms, if anyone listening is familiar with that. And I was very lucky at the time. As a physical therapist, I was doing outpatient ortho. I was working with a pelvic PT at the time for her issues. And
Mhm.
so I chatted her up and was like, what's going on here? This is what happened. And how can I fix this?
Mhm.
And she talked me through some deep breathing exercises, actually invited me into maybe doing another self pleasure and letting my orgasm happen, but then not really rushing off the bed, which, duh, that kind of makes sense, to do it that way. But that wasn't my norm. And I did have another experience where I was at a talk with Kimberly Ann Johnson. Maybe
Mhm.
you're familiar, yeah.
Mhm.
And
Yeah.
she wrote the fourth trimester, and she was giving a talk here locally in North County, San Diego. And by the end of her talk, which was about medicine, women, and power,
Mhm.
I was crying in tears, just like, what can I do to help women in this space? And she was like, if you have the chops, go into pelvic PT, because I told her I was a PT.
Mhm.
And I took that advice. Literally a few months later, I was signed up for my first prenatal yoga classes, like to teach, teacher training, and then pelvic PT certification. And I've just been going on since then. So that was back in, I think, 2018, 2019, and haven't looked back.
Awesome. I love it. Yeah, there is such a huge need for what you do. And again, especially I think you do have a unique spin on it. At least in my perspective, I know a lot of pelvic floor physical therapists, and I think you, again, like tying in like the energy and, our sexuality and our femininity, like all these different layers that make us women, you're tying
Hmm.
all that together with the physical, pelvis.
Yeah.
So I think it's really beautiful.
Thank you. Yeah, it's
Um,
been really wild to take all these pieces of my life, and of course, there are more pieces to that story that then blend into what this practice is now, which I feel like is pretty holistic and different.
Yeah. That's why I love to ask people's backstory because I think seeing your journey explains really well what you do and why. So I love to see that. Well,
Thanks.
for those who maybe aren't as familiar with pelvic floor physical therapy, could you give us a quick rundown of what that is?
Totally. I mean, I can tell you what the, I guess, like clinical version kind of looks like, and then maybe
Mhm.
what my expression of it is.
Yeah.
So typically, pelvic floor physical therapy is hands-on, hands-in, a lot of manual therapy to the pelvic floor region, which is, if you're unfamiliar, between your legs. Your pelvic floor is a group of muscles that really support you in your bladder, your bowel, and your sexual function, as well as birthing,
Mhm.
potentially.
Hmm.
So, yeah, the physical therapy side of it, that can look like if you're having any kind of discomfort or dysfunction, pain, pelvic pain, that is what we're here to treat. So, kind of, I mean, there's a whole rundown and different scenarios that can really lend a hand into what we do here. But my blend of it is yes, the physical aspect gets treated. I also blend in craniosacral therapy and somato emotional release. And then I feel like, yeah, on the clinical side of things, it's like very, these are your exercises. This is what you have to do to fix this. And if you have pain, let me know. On the other side of pain, though, is pleasure, right?
Hmm.
Or they sit right next to each other, I think, in this kind of cyclical way of thinking about it. But not a lot of pelvic PTs are comfortable talking about it,
Hmm.
which is fair, to each their own. But that is a side of pelvic health, women's health. That is
Hmm.
sexual well being and sexual health. And so that's something I love to dip my toes into.
Awesome. Well, again, I mean, I think that is such an important piece of our health
Hmm.
that I don't know, since like the Victorian era, I feel like we're still kind of stuck in this like old school mentality of women should not be talking about sex. They shouldn't be wanting it or needing it. It should like it's still weirdly taboo, even though sex is like all over, TV, movies. It's like we're comfortable with it in a certain way, and then it's also just not okay for women still. But it's absolutely, like you said, it is an important piece of who we are. And it also can be very important in our healing and our health, having a healthy relationship with sex. And,
Hmm.
even with, getting good blood flow to our pelvic organs and things like that, like it does have a really important function also.
Absolutely. I feel like the benefits of being connected to your sexual energy and your just sexual anatomy, your arousal anatomy, all of that leads into this other kind of life that you could live as a woman, right? That is vital, that is full
Hmm.
of life. And yeah, the taboo piece makes me laugh sometimes too, because it's like when you start talking about it regularly, it kind of doesn't feel that way. But then, yeah, I have to remember a lot of people are not comfortable talking about it. And that's totally okay. But that's part of my job is to make it feel like if this is a problem for you right now, like whether you're having pain or you're not experiencing pleasure or you're experiencing pain with pleasure, that's happened in my office as well, there's something we can do about it. And there's so many questions and so many layers that get into it, but it is also very interesting, right? Like before any kind of postpartum care, before any pregnancy or prenatal care, what about sexual care? What about the period care, the menstrual cycle care
Hmm.
that really needs to be, I feel like, all tied in
Yeah,
to
it has such
women's
an
health?
yeah, it can be so helpful there too. I mean, I'm really happy to see. I think pelvic floor physical therapy is much more common
Hmm.
nowadays, at least around pregnancy and postpartum. But I
Hmm.
agree, it can be so helpful with so many things that involve our pelvis, which is really everything. When you really like, how long ago was it? It was like probably 4 months ago or something. I hurt my tailbone and I like could barely function for a week because I
Yeah.
realized that my tailbone is literally tied to everything, walking, sitting, bending over. And I knew that
Mm.
already, but I was like, wow, what a powerful reminder that I literally can't do anything when my tailbone is out. So yeah, I mean, it's
Yes.
really so important for all of our health, like our whole body.
Totally,
Uh,
totally. The bladder and bowel stuff I feel like can be a really good entry point into that if you're
mhm.
noticing even that kind of dysfunction. That's something that pelvic floor PT, pelvic floor anything can like help with.
Mhm.
For sure. If you're not planning on having sex or having babies,
Yeah. So,
it's part of our daily life, hopefully.
yeah. Yeah. Definitely. And
Yeah.
on that note, so for people who are listening who are maybe wondering, well, that sounds great, but is this right for me? Or like like, obviously it could be helpful for anyone,
Mhm.
but who are the people, like you mentioned some of the symptoms that might be showing up? Like, who would you really say, yes, absolutely, this is something that you should reach out for?
Yeah, great question. I have all these things listed on my website,
Yeah, yeah.
but
Refer them to your website.
yeah, exactly. I mean, it's like I kind of have to feel like I feel like I have to categorize it a little bit, like whether it
Mhm.
is just perinatal, let's say, for pregnancy and postpartum. But I feel like sometimes even before that, like let's talk
Mhm.
preconception, let's talk sexual health and well-being. If you are having any kind of bladder symptoms, like say you feel like you have to go to the bathroom all the time, or say it's really difficult to release, say you're having a hard time with going to the bathroom number two, and or it's too much, right?
Mhm.
If you've had any kind of surgery, if you've ever had any kind of pelvic region surgery, hernias, low back pain, disc herniations, SI joint, tailbone stuff, if you've ever had a cesarean or umbilical hernia, if you have diastasis, like endometriosis, PCOS,
Mhm.
literally all the period things, it can really impact your pelvic floor
Mhm.
and the general well-being, like what you mentioned, just even the blood flow and that factor of, I guess, fullness, right?
Mhm.
Or feeling light enough to move dynamically and get into the daily activities that you want to be able to get into. If you're
Mhm.
someone who's, even injured from the waist down or waist up, getting back to any kind of activity like walking, running, bending over, like you mentioned,
Mhm.
that's something that pelvic PTs are expert in. We are experts in movement. And if you're feeling uncomfortable, you're feeling uneasy moving from your root, moving from your base of your trunk, then that says a lot,
Mhm.
right? If you're
Yeah.
feeling that instability or you're, yeah, feeling unsure of taking that next step, like we're here for you.
Yeah. Yeah. I love it.
Yeah.
Yeah. I have to admit, when it comes to like someone's having discomfort in pregnancy or they're getting ready for birth, I'm like, oh, of course, like you need to be going to
Mhm.
pelvic floor physical therapy. That's a given. Postpartum, just getting back into your new body, sort of like your body has like gone through this big shift, kind of
Yeah.
orienting back to that. But you're so right. I mean, it has like, it can be so useful in so many other places, especially for, yeah, those menstrual issues and pain. Absolutely, it can be huge,
Right.
a huge
Well,
piece of the puzzle.
it's really fascinating actually. I feel like I said, the bladder, the bowels, any issues with that are kind of like a segue for people.
Hmm.
And like you also mentioned, just talking not just about sex, but about our pelvic region is so taboo.
Hmm.
And what I recognize in my practice is that like say they come in for a bladder thing, like they do feel like they're going to the bathroom way too often. They think they're doing their Kegels, but they're not sure. No one taught them. Like they
Hmm.
learn from Cosmo. Like we all learn from Cosmo. Flex your PC muscle, especially when it comes to trying to get an orgasm going. But I'm feeling like I'm teaching them some basics that of course I would hope every woman could have the chance to know. And
Hmm.
then there's this realization of like, holy cow, no one taught me this. And there's like so much grief with that.
Hmm. Hmm.
And we kind of had to like go backwards almost and tread lightly and unlearn a lot of things before we can then learn all the good things, if that
Yeah,
makes sense.
absolutely. Yeah,
Yeah.
especially when it's learned in our body. Like if we're holding our pelvic floor in a certain way and we're just so used to that, then I'm
Hmm.
sure that takes a lot of time and effort to
Unwind.
release that or, unwind that and then learn a new way of even like holding your body.
Exactly. Posture. That's like literally
Yeah.
posture, you know?
Yeah. 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 I mean, that's part of your core and your, like you said, your trunk. In osteopathy, we learn the diaphragms. Like we have our thoracic outlet and we think of usually like our big diaphragm as our one diaphragm, but the pelvic floor is also one of our diaphragms. So even with breathing, it's super important. So many people are probably just like holding it tight and
Oh
not
yeah.
even, breathing as well as they could. So
And
absolutely.
that's
Yeah.
that's honestly one of the first things I look at with people. Like
Mhm.
I'll look at their standing posture and I'll get them on the table and check out some movement and walking, of course, but then I have to check their breathing. Like it is a no, what's the phrase? Like no exceptions. I'm going to look at your breath and I will feel your breath with you. And that's kind of, I mean, it might be annoying for some people, right? Where it's like, oh, simply I need to change my breath. And it's, yes, simply you might need to change your breath, like your
Mhm.
patterns of holding or the way people, bear down and push.
Mhm.
through a full inhale instead of on an exhale, or like a breath
Mhm.
hold. It's so many little things like that. But yeah, you're absolutely right. Your diaphragms are so interconnected from thoracic outlet, like up in the throat area or top of the trunk, and then the middle of the trunk, and then the bottom of the trunk. It's all
Mhm.
part of the core.
Mhm.
So
Yeah.
can't
Yeah,
can't ignore
we can't
either one.
ignore, yeah, just below the waist. We're like, ah, we'll just ignore that part.
Yeah. So true.
Well, we kind of touched on, to kind of go maybe through some of the phases that you work or, support women through. How about, with getting pregnant? Like, where is there a role for pelvic floor physical therapy in getting pregnant?
Yeah, this is where maybe, yes, the physical stuff can help, but ooh, this is so juicy, I feel like.
It is.
And it's like I feel like I would love more PTs to kind of be aware of this, but also if you're not open to that, it's like, okay. Let's kind of go backwards a little bit because yeah, getting pregnant has to do with having sex,
Hmm.
right? So if you are not able to experience sex in a way that feels pleasurable for you, whether you're having or experiencing vulvodynia, vaginismus, any kind of pain with penetration, really, or even just like dryness of your tissues for
Hmm.
whatever reason. Maybe you are someone who's coming off birth control and now trying to rebalance everything. Yes,
Hmm.
hormonally, deeply in your cells, but also, of course, like on the outside, physically, teaching someone how to nourish their actual tissues and how to lean into their arousal anatomy. That's
Hmm.
something that we can do in my practice. I love to guide women in their own hands on or hands in or wands on, wands
Hmm.
in. If anyone hasn't heard of a pelvic wand, this is what they can be used for, right? If you're experiencing any of that pain or tension, it's literally opening yourself up to the ability to receive.
Hmm.
You're receiving sperm, you're receiving this and accepting it, right? But if you're tense, closed up, closed off, that's something that we have to work on. And it always comes from a nervous system standpoint. If you are someone who's also highly stressed and you literally have a tight butthole, like that is your energy, that is your how you walk around the world, everything's just gripped up and tight. This is again where we have to show the nervous system, show your nervous system that there is some spaciousness to be had
Hmm.
and to breathe again into that.
Hmm.
If someone's open to the energetic side of things, like maybe there are some energetic blockages potentially,
Hmm.
energetic cysts. That's something that I like to work on too within the womb space or the pelvic space. But that's something I also can guide in a, meditation. This is kind of my, I guess, signature thing, but I will do hands in or like with one finger. Again, if you're not familiar with pelvic PT, we still clinically use like a glove and one finger to start, sometimes two, but with lubrication. This is where we kind of assess and treat what we find. But for me, I like to guide people in their own meditation. So it's very personal to them. And there's a lot to be felt there that probably sounds really intense for some. And it can be, but also so beautiful, so healing, so nourishing to acknowledge whatever is truly there and then releasing it if need be, or just having the acknowledgement and finding peace.
Yeah, that sounds
And
beautiful.
yeah, and with that, right? It's like, okay, when we actually feel open to this new path of potential motherhood, okay, so then say you do get pregnant and you're absolutely able to hold this energy, hold this life within you. That is a ever growing, ever shifting phase. So for 9, 10 months, depending on how long you want to take it, a lot of things are moving around, right? As baby
Hmm.
gets bigger, as your placenta's growing and taking up space, your all your internal organs are reshifting potentially.
Hmm.
More pressure on your bladder, more pressure on your rectum, a lot of pressure on your pelvic floor, on your belly. So this is honestly one of my favorites is to offer women not just pelvic floor massage because sometimes it's totally I leave it up to the woman if she wants to have any internal care done, like any pelvic floor releasing, but I usually focus on the belly and the back.
Hmm.
So, opening up the space on the sides and the back body to help give support to the front of the belly, where generally speaking, this is where tissues really like to grow and extend. right? This
Hmm.
is where we see any kind of diastasis happening. So that separation of the rectus abdominal muscles in the front. There's a way to minimize that and to support that. This is also where I teach a lot of the breathwork patterns where I want you to know these things. I want you to have connection to your transverse abdominis and your rectus and your pelvic floor and the diaphragm for as much as possible. And as
Hmm.
soon as you get that connection, you're going to maintain that throughout your pregnancy. You're going to tie it in with the movements that you love to do. And then we're going to apply that into postpartum because that is something that you need to connect to right away in postpartum. It's one of the
Yeah.
first things that you can feel comfortable doing. Because sometimes, depending on how things go, right, if you have a vaginal birth, you're not going to want to do your Kegels. Like, that's not what we're doing.
Right.
Absolutely not.
Yeah.
Please don't. And you're also not going to be doing crunches or planks right away. If you had a
Hmm.
cesarean, you're not doing that. We are doing tissue healing, we are doing breath work, gentle movement, maybe some stretching, but that totally depends on how you feel energetically, even.
Hmm.
Okay, so
I
then
love that. Yeah.
should I just take it to the next round?
Sure. Let's keep, yeah, you're kind of just like walking through the stages. So yeah, keep them.
Yeah, exactly. So then there's the postpartum healing. And I guess this is a misconception in pelvic PT land, but you don't have to wait until your 6 week checkup from your OB to get pelvic PT care.
Hmm.
So those sessions for me, if it's pre 6 week, I mean, the earliest I've seen someone postpartum is literally day 2. And
Hmm.
I've gone to people's houses. That's kind of a special little thing. I don't advertise that necessarily, but it is something that I'm willing to do. But that's where we're again doing that hands-on care that's really, really gentle. And we're doing not hardcore pelvic floor stuff, but we're definitely taking the time to assess, right? And you're gonna have to be active in the sense of caretaking. So let's optimize your posture. Let's optimize your breathing and I mean, what you can, I guess, clump together as a routine while you're
Hmm.
nursing a newborn potentially, right? And not getting a lot of sleep. But if you're someone who's like feeling really good at 6 weeks, you don't have to wait until 6 weeks to start doing your movement. So that's kind of the expertise that we again have, right? Is showing you a way to progress really easily, really safely to get you back to, say, running, right?
Hmm. Yeah.
I will say that something to maybe keep in mind for people, this is a big tip, I guess. The way you are progressing in your return back to movement should look very similar to the way that your baby is progressing in their movement.
Mm.
That could be a good timeline of pacing. One of my clients who I've been working with, I started working with her in 8 months pregnancy,
Hmm.
and I've worked with her returning back to running. This was like a year and a half ago, but that's something she mentioned as her part of her experience. And I'm like, this is absolutely, yes, this is true. Your progression is going to look a lot like theirs. And returning from like, say, crawling and getting those really basic moves down, which I'm kind of like laughing because, yeah, breathing is pretty basic, kind of boring
Hmm.
for a lot of people.
Hmm.
And it might be not what you're used to, especially if you are someone who's super active, want to CrossFit, want to run, want to swim. But your body will also tell you when enough is enough, right?
Yeah,
So,
I love that. I haven't heard that before. And I love that because I think, I mean, my experience too, being postpartum, it was like, okay, so I'm used to like being at a certain level and let's get back to that. And it's really hard to dial that back and to remind yourself, okay, my body has gone through this massive change. So I need to allow it to heal. And in
mhm,
doing that more slowly and, gradually, then you're able to heal better and not end up with a new issue or set yourself back
exactly.
even further.
Exactly.
Yeah.
Yeah. Like the little, I mean, obviously healing is not linear, right?
Hmm.
But
Hmm.
I think when you take it easier on yourself in that progression and go more, I guess, wouldn't say cautiously, but definitely more like slow and steady.
Hmm.
Like the slow and steady absolutely, I think, ends up winning this race. If you want to call it a win, want to call it a race. It's not about the bouncing back, of course. I think people hopefully have woken up to that by now. But I get that. And I think maybe it's another thing that potentially OBGYNs could just let them know, let the women know, you aren't cleared to go back to your full on routines that you did before, you're cleared to return to exercise in a really progressive way.
Mm-hmm.
Don't jump right into your running. You may end up with a prolapse. Like, let's be really gentle
Mm-hmm.
with these tissues. Like you said, went through a whole big transition physically, energetically, spiritually.
Yeah. Yeah. And it's so powerful. I mean, I think getting in tune with your breath and learning, the proper posture and things like that are so incredibly important during that time too, because your core completely shifts literally overnight.
Yeah.
Everything, like if you're nursing, you're hunched over, it's like there are so many different things that are stressing your body in a different way. And so I think it's also so powerful that even the breath and the connection with your pelvic floor in, like you mentioned, diastasis and just healing that even, but then also being able to support you in feeling your best through those new stressors on your body or new things that your body has
Exactly.
to do that didn't have to do before.
Exactly. Do not sleep on the power of your breath work, I will say.
Yes. Yeah. One thing.
Yeah.
And I wanted to say too, to take it back to, trying to conceive, and even before, I love that it's, I think preconception care is so important in what I do, and, taking an opportunity to improve and optimize our health before we even get pregnant so that we can optimize the baby's health too. But then I love that you can do the same with pelvic floor support with, really preparing, connecting to, a safe sexual experience,
Mm-hmm.
having those tissues be open, you're energetically open, maybe even counteract the stress of trying to conceive if it's challenging. Oh my gosh, sex becomes such a chore for couples. And all the couples
Mm-hmm.
I've worked with, it becomes, you know, tedious, boring, stressful. There's so many layers to it. And then add on
Mm-hmm.
top of that, if someone didn't have a very open sexual experience beforehand, or let alone maybe some trauma in the past or something, I can only imagine how big of a block that could be. And someone may not be aware of that at all. Like, oh, I just have some pain. I just have some dryness, like you're mentioning,
Right.
and
No,
then not see that this could be a big barrier energetically, physically.
yeah, that I'm so glad you named that because I was gonna say I feel really lucky that a lot of women are finding me right now that
Hmm.
are not ready to have kids yet. Maybe they are in relationships, maybe they aren't. It's kind of like, okay, if you think of a bell curve, I guess, of the life stages, like, yeah, majority of them are, say, 30 to like 50 is who I kind of see. But then I have these outliers, the younger ones that are literally as young as 17, 18 with
Hmm.
parental consent. If they are younger than 18, I get to see them. And I have these women on the other end who maybe their kids are grown and they're postmenopausal and they're still experiencing some kind of discomfort or pain, or I mean, maybe it's been chronic and it's been forever. It's not new, but I have these tail end experiences and I'm feeling really lucky that I get to have both. But for the young ones who are so open to doing this work beforehand, like they intuitively know that they don't want to be on their birth control anymore. Like they don't want hormones, they don't want a physical entity inside of them. It's causing them pain and it's not worth the peace of mind to not get pregnant at this point,
Hmm.
which I mean, to each their own again on that, right? Like
Absolutely.
pick your thing. Pick your thing with informed consent in that way.
Mhm.
And if you need support with that, like any kind of sexual trauma that's then leading to this just general feeling of disconnection from your pelvic space, like from your creativity, from your sexuality, from your pleasure,
Mhm.
if it's limiting you and feeling connected to a partner because of these past experiences, that's where I love to work too.
Yeah.
Yeah,
Yeah.
it's
I do
very
think,
magical.
like we were talking about how it is still taboo. It's still not where it maybe should be for women to be able to be in the full expression of their vitality. But I feel really hopeful too that I also in my practice kind of same bell curve
Hmm.
with with these younger women coming in, like you said, intuitively not wanting to be on birth control, wanting to connect to their menstrual cycle. Maybe they already have some symptoms that they're dealing with. And I find it really encouraging too, because they're really like they're so they're taking control of their power basically and so early on. And I'm like, oh yes, because so many people of my generation were like, oh yeah, we're like entering our 40s and now we're learning about,
Yeah.
like I just had a patient last week and she was like, I'm literally 38 and just realizing that my painful periods my entire life were not normal. It's like, yeah, like things get weirdly normalized and we just don't know what isn't, like we don't know what we don't know. So it's amazing when we can step into that earlier on and then have a completely different experience through womanhood.
Totally. Yep, exactly. I feel like it's a really interesting combination. I wonder if you've seen any of these women too who are like, say, in their 40s or 50s and they have young daughters and
Hmm.
their daughters are just about to potentially get their periods. I also feel really I feel like I'm the older sister slash auntie cousin, I don't know, who can
Yep.
kind of like meet both groups like in the middle. I feel like
Hmm.
you'd be the same in this way, like teaching these young girls in a way that's like not embarrassing, but you could also respect like, yeah, it's kind of embarrassing at first, but don't worry, you're gonna be fine. And it's actually a really powerful thing. Like, let's talk about these superpowers that you have within your pelvic space, within your period, and what that can manifest and look like in your life. And then, yeah, acknowledging maybe for the moms who didn't have that as a resource, but they know that that is powerful and something that they've come to realize later on in life. And they're gifting this knowledge to their daughters,
Yeah,
which
absolutely.
will just, I think, change the world.
Yeah. And it's so interesting to me, especially a lot of the moms going through perimenopause, like the
Yeah.
timing does, we all are at different ages, but the timing where maybe their daughters are coming into their reproductive health, or like, they're starting to get their period while their mom's going through perimenopause. I've had a lot of patients kind of joke about that. Like, we're both so moody at the same time. This is crazy. Like, who designed this? But it is on the flip side, outside of the moodiness, it's also an amazing experience maybe for them to go through of like, oh, we're both learning how our body is changing and, learning how to be in sync with that and go through the transition.
Yes.
Kind of cool.
Oh, that is so cool, actually. That's beautiful. It's like you end up, I guess, as the mother, maybe potentially, maybe this is how why it was designed this way, but you end up having that same compassion for your daughter because you might have
Mhm.
forgotten. You have 400 plus maybe periods in your lifetime. So
Mhm.
to remember back to what it was like to have your first one, I remember getting it, but I don't remember like what they were like, you know?
Hmm. Yeah. Yeah, I
So,
think so many of us don't because again, maybe we didn't really know when there was like maybe shame around it where
mhm,
sort of like, yeah, like I was bleeding, I don't know, I don't talk about it unless someone's like, oh, I was on the floor every time I had a period or I couldn't go to school. If it
right.
was very abnormal, then they really, know that that's not right. But yeah.
Exactly. Exactly.
Well, I mean, we kind of touched on some of the maybe like misconceptions and everything, but is there something that's like something that you think is maybe the biggest misconception or misunderstanding, something that you really want people to understand differently about pelvic health,
Mm.
women's health in general?
Yeah, this phrase has actually been coming up a lot for me, and it's I want you to know yourself best. And I think that comes from a a lens where I wasn't taught and I had to learn on my own. This was this very my career, my personal and professional life really did mirror each other, and it was a lot of like quote unquote me search that got me to where I am now. And I'm glad for that. And I just want other women, other people, even the men, if there are men listening to this, right? To know themselves so intimately well that they can then say share that with a partner. They can then share that with a trusted practitioner. They don't have to listen to potentially like an outer authority telling them exactly what is going on with themselves. Like I would love for there to be so much more education and accessibility to that education early on, and for that to be applied. Because I feel like when you know, say, about your pelvic floor, you know about how pleasure works in your body, you know about your period and your menstrual cycle and how that will impact you and really shapeshift you. You know about sex and what that can look like and how that all of these things also change over seasons, right?
Hmm. Yeah.
I think knowing yourself as best as you can through those seasons is probably the biggest, not misconception, but it's the biggest advice that I have. And that's part of what I do, right? It
Hmm.
is educating and guiding people to know themselves better.
I 100% agree with that. I love that so much. Because I do the same from a different
Yeah,
approach, right? I have a different,
totally.
a different feel or
I
approach that
feel
I'm taking with people, but exactly the same, right? Getting in tune with the power of your hormones, your menstrual cycle, your health, really knowing your body so that you can go to a practitioner and know when it's BS and you're like, no,
Mhm.
wait. Because I think so many of us do look externally for support. And so many, especially women, but people in general, they go to a doctor or, some outside practitioner and are like, okay, I think this is not right. Like, I think I have something going on. And then they ask them for support. And it's like, no, you're fine. Like your three lab markers that we tested are normal, so you're fine. And they're
the
like,
three.
okay, like just leaving with their
Oh,
they don't know. Like I guess I'm normal. I don't know. I feel like I'm not, but I don't know what else to say or, what else to do. So I absolutely agree that if we know, wait a second. No, but this is how my body is. This is like where I am in my life or the season that I'm in and I'm used to it being this way and it's not that way anymore, then there's so much power that we can have. And again, taking back the power from these people that we expect to heal us and be able to heal ourselves and use people to support that, like find the right practitioners to
right.
then support that and finding that wellness.
Right. I think that's why our work is so, like, why we resonate with each other and why it's all
Mm,
complementary. Like, we really come from that perspective of we're here to help guide you, but I want to guide you deeper into knowing yourself. I want you to
mm,
be able to advocate for yourself, which, again, I get that that can also be really annoying to hear.
hmm
We do have to do it though, because as we're learning more about ourselves, I think, and we're lucky enough to also be practitioners who had greater education on it. And I don't
hmm
expect everyone to know every single little thing, but I feel like the more we lift ourselves up and we lift our women around us up, then they're going to pull up these other practitioners kind of like alongside them. I would hope.
Yeah.
That's my prayer.
Yes, I agree. And I think even just, I mean, one thing that's so beautiful about social media and the internet now is that we can at least have these conversations and someone can just hear or like mention it to a friend. And even if it isn't, like you said, they don't need to know everything. They don't have to do it completely themselves. Hopefully they're not because that's a lot to take on. But being able to know, okay, wait, maybe there is a better approach to it. And then, yeah, knowing that at the end of the day, the power lies within them, but then people like us are there to be their strategy and their, support system, their cheerleaders, so that they're not doing it on their own by any means, but they're still like in the driver's seat, basically with
Exactly.
everything.
Exactly. They feel empowered enough to do all the things for themselves with the proper support, education, guidance, advice. Yeah. And like they
That's,
can like test taste everything for themselves, you know?
yes. Yeah.
Totally. Yeah. Because it's your life.
Well, yeah, right? It's like, yeah, you're the one living in it. You know your body better than anyone. So, yeah,
Yeah.
you should have the power with your own health and wellness. Yeah.
100%.
We've already shared some amazing tips and takeaways, but I'd love to, I know you have some more tips to leave the listener that maybe are some actionable things that they can start now.
Ooh. Yeah. I mean, I'm playing with ways to share my work that isn't typical of a pelvic PT. So, kind of to branch out a little bit. I mean, it's not out yet at the time of this recording, but I do have a podcast also that is out. However, season three, I'm modulating it a little differently than I
Mm,
have in the past, where I love having the guest conversation. So, those aren't going anywhere, but I will be adding more solo reflections about past client learnings and lessons. And
mm,
then I'll also be sharing my pelvic meditations. So they will have a different theme and flavor and expression, I think, each time. I am sharing them on Insight Timer right now as well. But again, because I want less friction to be there for them to access it. So
mhm.
those will soon also be out wherever you listen to your podcasts. So,
Awesome. I love that.
yeah.
I've, I think, oh my gosh, it's been a while now, but I gave a talk to your group at one point and you'd
Yes.
led everyone through a visualization that I was like, oh my gosh, this is so beautiful and powerful. And like we were talking about, even just our breath is so important with our pelvic health. And the energetic piece can be so powerful that I think that's such a beautiful addition to anyone's, wellness routine, whether or not they have symptoms or concerns.
Exactly.
Awesome.
Yeah. Well, thank you
Awesome.
for that. I appreciate that. I feel like it's a different kind of way to use the voice. So that's really fun. And yeah, kind of
Yeah.
take my yoga teacher training into a different direction.
Yeah. Yeah. Well, again, you have such a unique positioning in this field to be able to guide people in a certain way, maybe beyond just, I shouldn't say just, but a yoga teacher could, or a pelvic floor physical therapist, you
Sure.
have this like blended experience where you can then, guide things, I think, more specifically.
Totally. Totally.
Yeah.
Thank you for that.
Well,
Again,
yeah.
appreciate
Yeah.
it.
Any like last things you want to say, the things that we haven't covered that you want to mention?
Maybe I'll share. Can I share a little bit about vaginal alchemy?
Yeah, sure.
Okay. Yeah, it's a live guided group experience that I've then turned into a self-paced experience because again, I feel like I really want women, yes, to experience the magic of connecting to their womb space, their pelvic floors, and have the not just audio guidance, but video guidance and the education prior, kind of like learning the theory and then having the practicum, if that makes
Mm-hmm.
sense.
Yeah.
So, kind of sharing from the, I guess, baseline, let's call it baseline education of what I would want every woman to know, but then also getting these guided, hands on, hands in experiences, which can for sure feel like number one, there's friction and resistance to being with yourself in that way. And if
Mm-hmm.
you have any kind of pain or resistance to pleasure, it's another way to access this and then start to become more open to it if that is truly your desire.
Mm-hmm.
But it's for so much more beyond that. Like, I mean, I think a lot of the women that have gone through it have experienced, say, like a segue off of something like a vibrator, which is something that I've experienced, and
Mm-hmm.
then entering something more through the lens of slow pleasure,
Mm-hmm.
and then feeling more, not just access to life in your body, but like more access to your life on the outside and taking things that say haven't sat well with you, whether that's traumatic experiences or boundary ruptures of any kind, and alchemizing that through the workings of your body in your
Mm-hmm.
pelvic space and creating something brand new out of it. So,
Oh, that sounds amazing. I feel
yeah.
like that sounds like such a I mean, to the point of this entire conversation, it's like such a good starting point for anyone, especially if they do maybe feel a little bit
Yeah.
shy or uncomfortable with going to a practitioner, being able to start at home with themselves and just starting to, build that connection and explore.
Exactly. Exactly.
Amazing.
100%. Thank you.
I
Yeah.
love it. Well, Brittany, thank you so much for being here today. It's always such a pleasure talking with you. I'll make sure that, everything that you've shared today is linked so people can find you and benefit from your work.
Perfect. Thank you so much, Miranda. I've loved talking to you too, as always.
Yeah. All right. Thanks.